Welcome to Product Reviews TV. In this episode, we're going to review major medical health insurance that you can get through the healthcare marketplace. And we'll see if you can qualify and what are the qualifying life events because we are outside of the open enrollment period, which begins November 1st. But let's just take a look and see here, according to healthcare.gov. You can get or change health coverage for the rest of the year if you qualify for the special enrollment period due to a life change. Certain life events like losing health coverage, moving, getting married, having a baby, or adopting a child may qualify you to enroll in or change marketplace health plans outside the yearly open enrollment period, which starts November 1st. So if you just don't like your insurance, you can't, that's not a qualifying life event. It has to be something specific like one of those issues that's mentioned there. So let's take a look at a website that can help you to get that very easily instead of going through the whole process of going through healthcare.gov, which can be involved. You can go here and see what plans would be of interest to you. So we'll just put in a zip code. And you don't have to put your name in if you just want to quote and see what plans are available. You can do that. And of course, here this information is important. So let's just say you're a 42-year-old male. You're a non-tobacco user. And again, the use of tobacco doesn't affect the cost of your plan through the healthcare marketplace with these major medical plans. Other plans that might be through a private carrier outside of the healthcare marketplace might be affected by that. But through the marketplace, which is the government subsidized plans, those particular plans, tobacco usage would not be a factor. And you have these other things that you can select as well. Add a spouse or a dependent. Let's just continue. How many people are in your tax household? So how many people uh, live in your household that you take care of, or maybe they take care of you? What is your household makeup? Maybe it's you alone, or it could be maybe there's two people. If it's two or more, they're going to ask you this question here. Any members who aren't applying for coverage under 18, maybe no or yes. If you say no, that's fine. Your estimated 2022 household income before taxes. What does it say here? Include the taxable income of anyone you're claiming or filing taxes with, even if they're not getting coverage. A guess is fine for now. Your income determines if you're eligible and how much savings you're eligible for. So your total taxable household income. So maybe you earn 20,000 and your spouse earns 20,000, then your total household income you'd have to put here would be $40,000. Okay? Now, let's go further. And what it says here is that you may qualify for two kinds of savings. This is how much of a subsidy the government will pay towards your monthly health insurance, $413. Any plan that you select that goes beyond that, you would pay the difference out of your pocket. So it says here, this means you'll see plans as low as $0 per month for your health insurance. So let's take a look at that. And let's see what's available. Now, it's currently special enrollment. So during the special enrollment, you need a qualifying life event to enroll in a health insurance plan. So, a qualifying life event, what would that be? Are you losing coverage? Select this if you have lost or will be losing these types of coverage on the job, uh, Medicaid, individual or group plan, COBRA, any one of those. Or it could be a change in the household. You got married, had or adopted a baby. You got divorced, separated. Change in your primary your living area. You're moving to a new home in a new zip code or county. Moving to the U.S. from another country. Uh, a student, a seasonal worker, moving to or from the place that you live or work. Moving to or from a shelter or other transitional housing. Change in eligibility. You enrolled in coverage and report changes that change your eligibility. Become newly eligible for coverage due to recent citizenship, nationalization, or becoming a lawfully present individual. Become newly eligible for coverage after being released from incarceration. So, all of that would apply. And of course, maybe there was a plan enrollment error, misinformation, misrepresentation. That would be something that might qualify you for a special enrollment. And of course, here, other situations, you applied for Medicaid during open enrollment or after a qualifying life event and weren't eligible. A victim of domestic abuse or spousal abandonment. Um, so these things could also apply as well. So let's just start with, let's just say we lost coverage. And here's the statement made here. To be eligible to enroll, you must have either lost coverage in the last 60 days or be losing coverage in the next 60 days. And it gives you specific dates there so that there's no mistake. If you lost coverage on or after January 1st, 2020, and missed this 60-day window due to COVID-19, then you are eligible to enroll. So let's move forward. Do you have any preferred doctors, pharmacies, or hospitals? You could plug that in there to help narrow it down to specific plans that would be good for you. Do you take any prescription drugs? You could do that as well. It'll again narrow it down to the plans that would specifically target coverage for those types of prescriptions best. Now's a good time to save your progress, so you put your email address in there. You can always refer back to it if you need to go back. And here's the plans that come up. So your savings, this is what the healthcare.gov, the government, is going to pay towards subsidies towards your health insurance. And so normally the plan, this particular plan is $377.64 a month. But because the government is subsidizing you, your cost monthly is $0. It has a high deductible of $8,700. Doctor's visits are free and no charge after the deductible to see a specialist. So that might not be the best plan for you because if you do have to go to a specialist, those specialist visits could range anywhere from $250 to $500 for a specialist visit. And of course, if you need generic drugs, of course, again, you have to come up with your money on your deductible before the insurance company is going to pick up the rest of the bill. So let's scroll down and let's see what's maybe some better options. Here's another one. Again, it was normally $405, but because your plan pays $413, it's still a $0 plan monthly for you. High deductible again, and we talked about in other episodes about using accident and critical illness coverage to pay off your deductible in the event of, say, you contract cancer or you have a heart attack or an accident. That ancillary plan that they call it, those extra plans that you add on, can pay that deductible for you. And then, of course, your plan would pick up the remaining of the costs because your total out-of-pocket max would be the $7,900 plus an additional $800. So your total out-of-pocket that you would have to come up with in that year would be $8,700, and then the insurance company picks up the rest of the bill. So if you have an accident plan, a critical illness for heart attack, stroke, kidney failure, cancer, you have one of those plans for a modest monthly fee. Those plans can pay a cash benefit lump sum to you that can pay off that maximum out of pocket cost. And then the insurance company, Florida Blue in this case, would pick up 100% of the rest of the bill. So pretty nice. Your doctor's visits are free. Specialist visit, again, those are usually $250 to $500. Would only cost you $20, and your generic drugs would be $30. This particular plan is called an EPO, so an exclusive provider organization network. And if you look at the plan details here, you can break it down and see how it's broken down for you. Right here, primary care visits, specialist visits, preventive care visits are always at no cost to you. Let's see what they include. Everything from checkups, counseling, screenings, immunizations are at no cost to you under this plan. A specialist visit would be something like a dermatologist, a cardiologist, a neurologist, an oncologist for cancer. That's what that would fall under. Your primary care visit, of course, would be your primary care provider looking for a sickness or an injury, something of that nature. A regular checkup is what you would see them for. Now, we go a little bit further here. You have a prescription drug formulary, of course, that you can look at what falls under your plan. Generic drugs, $30. Brand name would be full price and 50% after that $7,900 deductible is met. And of course, you have hospital coverage. Urgent care is only $85. So instead of going to the emergency room, you go to urgent care. Emergency room would cost you anywhere from $1,500 and up for that visit. Here, under your plan, you go to urgent care. It's only $85. Emergency room visit would be full price until you meet your deductible. Hospital stay is the same. Mental health and substance abuse, outpatient services, $85. Hospital stay, these are the numbers here. For pregnancy and birth, well baby care is free. Labor, delivery, hospital stay, you have to pay the full price on that. So that plan, depending on your situation, it may or may not work for you. But there are many options, and if you pay a few dollars more, then the options oftentimes get better. If you need to look at the full detail of the plan itself, you can always go to the summary of benefits. And when you open up the summary of benefits, it gives you all the details, everything you would possibly need to find out about that particular plan. There's a phone number there that you can call for any questions about the plan. And it's very, very specific for every type of condition or service that you're looking to have done. Diagnostic testing, X-ray, blood work, co-pays for those things, CAT scans, PET scans, MRIs. All that information is found in the summary of benefits, and it tells you what out-of-network costs would be, as well as in-network. If you're going in-network with Blue Cross Blue Shield in the state that you're in, or you leave the state, you can still leave the state and get Blue Cross Blue Shield benefits, but they're going to charge you differently. It's going to be more money once you're out of state. Because even though it's the same name company, you're still out of the local network of your particular city or state. So keep those things in mind, and you can go through all of this detail right here to see what those benefits would be for you. Now let's go back. Let's close that out. Let's go back. Let's see if there's any other plans with a better coverage for hospitalization. There's also a $0 plan there. And let's see. As we scroll down, we have many, many options. And of course, these are bronze plans. Bronze plans oftentimes will have a $0 premium. But when you step up to the next level, let's see. On the next page here, there's more bronze plans. Here. And the criteria changes. Then you have different companies like Ambetter, Oscar. Now, if let's just say you want to reduce those costs for hospitalization and your prescription, maybe you want to go to a silver plan. Let's look at silver plans. So your silver plan, you may pay more money. You may pay a few dollars a month. Here, your deductible is a lot lower though. So, and your max out of pocket is much lower than that $8,000 that was with a bronze plan. So your doctor visits are only $5, specialist $40, generic drugs. Let's take a look in here for $41.54 a month. What's the advantage? Of course, preventive care visits are always free under the healthcare marketplace plans. That's a government rule. And down here, generic drugs 15, preferred generic 3, imaging, you'd have to pay full price under this plan. Urgent care is $40 instead of $85, and of course these costs are involved here. So let's go back. Let's see if we can find something even better than that. Let's see. We want something that is going to reduce the our out-of-pocket costs as best as possible. And let's see what we can find. Of course, as we go higher to gold plans, would be a different rate. Here we have these particular plans here, zero deductible. But remember, you always got to look at this number, the out-of-pocket maximum. An out-of-pocket maximum is the most you'll have to pay within a year for healthcare services. So once you've reached your out-of-pocket maximum, your plan begins to pay 100% of the allowed amount for covered in-network essential health benefits. Costs that count towards your out-of-pocket maximum must include deductibles, co-insurance, co-payments, or similar charges. Okay, and your deductible is uh, the amount your health plan requires you to pay for your health care each year before your plan benefits kick in. So before you meet this amount, you are required to pay full price or the designated before deductible amount for health care. So many people don't have the money to do that. So they elect to go with a $0 deductible. But again, at the end of the day, whatever the costs are for your service, you're going to wind up, this is going to be your maximum out of pocket for the year. So higher monthly premium, lower deductible, lower max out of pocket. That's how these particular plans work. Let's take a look at a gold plan.